Hi there. I'm Dr. Bloom. I'm going to be conducting your cranial nerve examination today. Yes, it's nice to meet you. Now, why don't you go ahead and have a seat? Get comfortable. Wonderful. Okay. Now, are you familiar with a cranial nerve exam? No? Okay. Basically what this is it's classified as a neurological exam, and we're going to be testing various aspects of your cranial nerves through physical examinations. Yeah, for instance, it will involve a sort of vision test. We'll be testing your olfactory nerves, which is basically your sense of smell. And we'll also be testing your hearing and some of your basic motor functions, just to kind of test your neurological activity and response. And it's really nothing to be nervous about whatsoever, and it's not painful at all. Yeah. No, there's no shots involved, so you won't have to worry about needles or anything. Yeah, we don't even have to draw blood for this. Okay? Okay. Well, what I'm going to do now is I'm just going to start with basically a test of your motor functions. So I'm going to have you do different movements, and then I'm going to enter the data I gather here right in the computer. Exactly. Well, we find it's the best way to gather the data. It's more efficient, definitely, rather than writing it out. Exactly. Okay, so let me bring up your chart. Are you nervous? Oh, I know. I have a lot of patients that come in here, but I can assure you, I've been doing this for years. I'm very experienced, and the examination itself is really quite harmless and pain-free. All right? Okay, what I'm going to have you do first is I'm going to just step right in front of you, and I'm going to have you carry out basic actions and just do them to the best of your ability, okay? Great. Okay, the first thing I want you to do is I want you to raise both eyebrows for me at the same time. Wonderful. Okay, now I want you to kind of look straight at me, and I want you to give me a frown. Great. Okay, now I want you to close both eyes very tightly so that you feel as if you can't open them, and I'm going to try to gently pull them open, okay? Just kind of squint very hard and hold your lids as tightly shut as you can, and then I'm going to try them pull them apart very, very gently. Okay, great. Now, if you could, can you give me a big smile? And I need to see your upper and lower teeth. Okay? Yeah, it looks great. Okay. Okay, now I'm going to need you to smile for me again. And this time just go ahead and smile, a closed mouth smile. So no need to part your lips. Wonderful. Okay. Now I'm going to, the last motor function test here, I'm going to have you kind of puff out both of your cheeks. Kind of like a blowfish, yeah. Okay, fantastic. You did beautifully. All of the responses were within normal range, so that's wonderful. Okay, we're going to move on to the next part of the test now, which will be your sense of taste. Okay? Give me just a moment to gather the taste strips. Okay. Okay, I have the taste strips right here. Okay, I'm going to have you open your mouth. I'm just going to place it very carefully on your tongue. It's going to dissolve. It's a bit like the mouthwash strips that you can buy now where they kind of freshen your breath. So it'll just dissolve right on your tongue. And all of them are pleasant. All of them are pleasant flavors. You don't have to worry about that. Okay, I'm going to put the first one on your tongue right now. Okay, and can you tell me what flavor that is? Wonderful. Okay, I'm going to do the second test strip now. Just go ahead and open your mouth for me. Okay, I'll place it on your tongue. And what flavor is that? Great. Okay, I'm going to do one more test strip. You're doing wonderful so far. And open your mouth. And I'll put it on your tongue. And what flavor is that? Fantastic. Okay, again, all of your test scores are within normal range for that. Okay. Now while I have you, here, I'm gonna have you try to shrug your shoulders. So just go ahead and shrug your shoulders for me real quick. This is going to test your accessory nerve. Okay, wonderful. And I need you to turn your head to the left and then turn your head to the right. This is also testing the accessory nerve. Fantastic. Beautifully on both. All right. And let me have you stick out your tongue for me just one time. I'm testing your hypoglossal nerve. Okay, wonderful. It looks symmetrical, looks like it's responsive. Great. Are you doing okay? Okay, see, I told you. Yeah, it's nothing to be nervous about, nothing painful whatsoever. Okay, let's go ahead and move on to the hearing portion of the test now. What I'm going to do is I am going to say numbers into your ear, and I need you to repeat which number I'm whispering, okay? It's going to be kind of a soft whisper, so you'll really have to kind of listen for it. All right. Okay, so I'm going to go to the right ear first. All right. 5. 10. Wonderful. 7. Great. Okay, I'm going to go ahead and move over to your left ear then. Okay. 3. Great. 1. 9. Wonderful. Okay. Go ahead and move on to the next portion of the test now. I am actually going to be doing kind of an eye examination. So first I'm going to shine a light in your eye and just kind of check out, kind of take a look at the iris and the cornea and all the various aspects of the eye that I can see. And then we'll move on to just a brief vision test. And I'll also check kind of your visual acuity and your visual field. All right, great. Okay, just kind of trying to keep your eyes open for me. I know it's a bit difficult. If you do have to blink, just go ahead. Alright. The right eye looks good. And same thing with the left eye. Terrific. Okay. Alright, now I'm going to actually have you cover your right eye. And I want you to look straight ahead at me. And I'd like for you to tell me how many fingers I'm holding up. Fantastic. Okay. Now, I'm going to wiggle my finger in your field of vision, and I want you to tell me when you stop seeing my finger with your left eye, okay? And move it very slowly. Perfect. Okay. Okay, now I'm going to move aside for just a moment. There's a vision chart right behind me, and I just want you to read the top row for me with your left eye still. Great. Okay. Wonderful. Okay, now I'm going to have you do the same thing with your right eye, so cover your left eye, please. And I'm going to hold up fingers, and please let me know how many fingers I am holding up. Wonderful. Okay, now I'm going to wiggle my finger very slowly within your field of vision and tell me when you stop seeing my finger. Great. Okay. Now again, I'm going to have you read the second line now on the vision chart that's just there on the wall. Beautiful. Okay. You're doing so great. Okay, now I'm going to just have you remove your hand from your eye again, and I'm going to shine a light kind of in your eye, and I'm just going to see how your eye and your pupil reacts to it, okay? Okay, the left eye first. Okay, everything looks great here. And then I'll go to your right eye. Everything looks great there too. Okay. Great. Okay. Yeah. This test isn't very long. It doesn't take too long, so we're almost done, in fact. Okay. Now I'm going to do the final test, and that's going to be testing your olfactory nerve. So I'm going to, kind of like we had with the taste test, I'll be using these, they're basically cotton swabs that have been dipped in a particular fragrance or aroma, and I'm going to have you tell me what the smell is, okay? Okay, again, they're all pleasant smells. Okay? Try the first one here. Great, yeah, cinnamon. Okay. I'll try the second one. Perfect, chocolate. Okay. I know that's one of my favorites too. And we'll try the third one. That's right, it's vanilla. Okay. Okay, now I'm going to just take a brief look at your nose, kind of in your nostrils, and kind of feel around to make sure the sinus cavity is, it's just a little extra something I do. Okay. Everything looks great here. Okay. Well, that was it. Yeah, nothing too scary, right? Yeah. Well, yeah, let me just kind of show you your results here. As you can see, you tested on this chart here. You tested within all the normal ranges. Yeah, we're able to just input the data right into the computer and bring up your chart right away. So yeah, that's what we do it this way. It's fantastic. So all of your neurological functions are great. Everything's responding properly. All of your reactions are right on. So yeah. hmm Yeah. Well, there is an additional test I can do if you would like me to do that. It's basically testing your trigeminal nerve, and it's just basically I'll just test your mastication muscle, so basically your mouth, and then I'll be touching just key points on your face to kind of see the reaction. Would you like me to do that one as well? Yeah, that's the last thing on the chart there. It's an optional test. You would? Okay. Well, yeah, I have another thing of, I have cotton pads here that I'll get out of this. Okay. And I'm just going to basically touch key points on the sides of your face and just see how your nerves react and let me know if there's any pain or tenderness, okay? Okay. Okay, now I need you to open your mouth just a bit. Just gonna kind of touch your chin here. Not too much pressure, of course. Okay, open your mouth a little bit wider for me. Okay, perfect. Responded nicely as well. You're in tip-top shape. Yeah, I'll actually be sending you home with this chart. It's just a little printout we give all of our patients. It's not as detailed as the one we put in your actual folder, but it'll give you some basic information about why the various tests were conducted and how your results are on the scale. All right. Yeah, well, it was wonderful meeting you. And, yeah, well, yeah, you can come back in next year if you want to do kind of just an annual cranial nerve exam. That's perfectly fine. Wonderful.